Warning: viewer discretion is advised as this report contains graphic content.
Now his mix is ready. He puts the sponge so the needle doesn't get blocked. He will then tie his arm for the blood veins to pop and be visible. He now unties himself and shoots. The next guy is doing the same thing. He must inject the blood. Now, what he's doing is called flushing, so the blood flows in his veins throughout the whole body system.
Yeah, my sister. You see, now I feel like taking my camp chair, go and sit by the beach and relax. Yeah, half naked, you know. Get the sea breeze with a cigarette in my hand and a cold beer in the other. Yeah.
For Siphiwe Magwagwa, who lives in Soshanguve, Pretoria, using nyaupe was just for fun. A method he says was influenced by his friends. Now 10 years on, it's an addiction he can't escape.
You know, for me, it was peer pressure. My friends were smoking it, and I didn't. So I ended up trying it out. It can take you on cloud 9, you know. So every morning they would bring it, and I ended up being hooked. Without it, going to school is the last thing on your mind. You have to smoke it first before you go to school. I'm really worried because I want to quit, but I can't. Mostly, Bluetooth is good for the ladies as a method of taking it because they can't hustle. So they hustle from the boys. Therefore, they have no choice but to use their method.
In the spirit of getting high, the latest vampire-like method, dubbed Bluetooth, is understood to have addicts exchange blood through a syringe to share their high to cut costs. A phenomenon taking many by surprise.
The
Bluetooth method is when one offers you their blood. Just like I would ask my guy here to give me his. We share. Once I've injected his blood in my system, I would feel the difference. Sometimes this thing can make you gain or lose weight. It all depends on your diet.
I started using Bluetooth method in June the previous year. I've been smoking, but I didn't feel much. My friend then gave me 5 milliliter, and after that I actually felt the drug functioning and it was effective. So in the morning I woke and went straight to him and told him I do no longer want to smoke marijuana. And I asked for a syringe since he is the one who had it. He woke up from bed and went to buy. Nyaope becomes cheaper because the Bluetooth method is 10 rand, especially when you are high. They actually draw their blood and sell it to you. In that manner, at least the craving goes away for a while.
But this drug not only has men addicted, but women too. At just 35 years old, Lebo Mudiba took her first hit when she was drunk.
But then I
was drunk when I started, and it was different. The following morning, I went straight to my friend and told her how effective it was, and I wanted to use it when I was sober. We then put the money together and bought it. After smoking it, I was more high, like never before. So ever since that day, there was no turning back. It was the best thing ever.
Every day, from there, because of good, really different from Zolo Yaka Yamato. That's how I started.
But families of Nyaope addicts feel weak and powerless. They often watch their loved ones become a slave to the drug, doing anything to get their next fix.
No, I
have since inquired at the police station, and they told me to start at Navkok. Then I came back to tell my mother about it. We never got a chance to go with him. So for us to take him with us, we had to sponsor his habit because it is impossible for us if he hasn't smoked. My brother was a good guy before he started with Nyaope. Actually, he started by having friends, and these friends would take him and they would go out to drink, as he was someone who would smoke marijuana. After some time, I noticed that he was smoking Nyaope, as we used to fight a lot. Little did we know that this thing would end up affecting him so badly.
As a family, it affected badly because, as she said, and trying to make sure because you never know anything.
As a family, this thing has affected us so badly because we ended up not trusting my sister. Most of the time we have to lock the doors because she might take something of ours and sell it just to get a fix. Sometimes I have to do the house chores alone because she would be out there hustling. As siblings, we used to talk about anything, but things have changed now, and our thinking level is on a different scale. Also, my mom and dad are highly stressed because of us, so everything in this house is very complicated because of our past issues, including my sisters.
My dad, but stressed, they are always stressed. Even if maybe they are personal problems, but when it comes to Runa, like their precious daughters, very stressed. So like everything more high, complicated due to the issues that my sisters' issues. Like the old Lebohang or missing.
All I want is for her to be the old Lebohang that I have always known, someone I used to share everything with, the mother to a daughter to my parents, and a friend to me.
A daughter to my parents, and a friend to me. that's what I wish for.
I feel so embarrassed because my wish was for my mother to be a doctor. My mother once told me that when I saw the drug packets, I should just empty them. But I got scared.
So what is it? Why? Now the South African National Blood Service has raised its concerns and has warned the public that mixing incompatible blood types can be fatal.
Well, the first risk really would be transmission of what we call a transmission of infections. So infections that can be transmitted in blood. So that would be number one concern, obviously, in this population in South Africa. Our biggest concern would be transmission of HIV, and then a whole host of other viruses, such as your hepatitis, can be transmitted through such a practice. And then, of course, there's a whole lot of other pathogens. There's bacteria as well. There's parasites as well that can be transmitted. So there is a huge risk in terms of infection from that one person. Now, and then second to that, there is what we call sensitization that can occur because as human beings, we have different blood groups. I don't know, you might be aware of this. We have different blood group systems. The main blood group system being what we call the ABO blood group system. That is where you would be told that you are either an A blood group person, a B blood group person, an AB or an O blood group person. And there's other smaller blood groups which are not as popular but are also significant. So what happens is whenever a person gets blood, let's say in a medical setting where a person gets blood as blood transfusion, the blood actually gets tested to ensure that it's the right blood group as in terms of the ABO blood group. We also test for another common blood group which is called the rhesus blood group, where you can either be a rhesus positive person or a negative person, and if you're positive you get blood from a positive person, if you're negative you get from negative, but obviously if you're positive you can also get from a positive person, a negative person as well. And then in addition to that, we also test for what we call allo antibodies before we give anybody blood. And this has to do with other minor blood group systems, which however can be significant and can cause complications if one were to get blood from a person.
With high levels of crime and social ills, many communities have been under siege.
As a community, we are highly affected because our children are in too deep in this Nyaopi phenomenon, and we don't know what else we can do. We really wish the government could help us because as parents, we have run out of ideas.
Throughout the community, we face many challenges about this thing, Nyaope, due to unforeseen circumstances, and they don't have a choice due to lack of support their community. Like maybe we have police stations more around social group, whereby they go throughout Kodikolong, then they teach us about drugs. So like so like I have no choice. So mom get peer pressure, ya di chomi. Yeah.
South Africans believe drugs are the main driver of crime over the last 5 years.
But public perceptions are very important, including in relation to what are the drivers of this crime. For instance, they see 70% of the time, 77% of the time, drugs being the driver of crime. That's the one thing. And then, of course, poverty, and of course, greed as one of those. And when you take those together and start aligning policy towards those, then you may start addressing the real drivers of crime, including the fact that people who are in assaults or rape, in the majority of cases, are people who know one another. And therefore, there has to be it's a crime that cannot be policed by the police. It's a social problem. And to try and impose on the police to do something about that on their own, it's actually asking for no solution. So the data at our disposal gives us a carpet, so to say, of issues that have to be looked into as we tackle crime.
For Nyaope users like Lebo and Lillian, they are desperately calling out for help. However, challenges like relapsing, not enough education on government-funded centers remains a big issue. Community members and families are also worried with the new trend of Bluetooth Nyaope. This becomes a sad reality that the fight against Nyaope is far from over. Nyaope first reared its ugly head around 2006 in urban townships. It has the makings of a perfect storm. It's cheap, highly addictive, and its withdrawal symptoms are among the worst of any drug, making recovery near impossible.
I think the rehabilitation of Nyaope is one of the most difficult substances to do the rehabilitation. And if I can shortly say, it is because Nyaope is just not one substance, it's a combination of several substances. That's one reason why it makes it difficult. And the other reason, we must understand it's an opiate, a painkiller, and these are one of the most difficult substances to do rehabilitation on. And that is why, yes, we can see in our patients they're suffering, it's difficult.
The dramatic rise of Nyaope has also caught the attention of President Jacob Zuma, who believes, together with society, the social ill can be fought against.
Government working with society is fighting social ills that are tearing communities apart, such as drugs and substance abuse. From Soshanguve to Rosettenville or KwaMashu to the Cape Flats, communities are in difficulty because of the drugs. Other than law enforcement, the provision of treatment and prevention services is also critical. The Department of Social Development is building new public treatment centers in provinces where there are no such facilities. In the Northern Cape, Northwest, Limpopo, Free State, and the Eastern Cape. Working together, we will save our youth from drugs.
Government says people classifying this Nyaope as illegal and provides free rehabilitation centers.
Well, I think firstly also got to be a drug addict themselves, and they can actually go to any social welfare agency, the Department of Social Development, or any one of the private organizations, because what we require is a social work background report, a social report, and also a medical certificate from a district surgeon, and then we also require from that, social workers outside, they know what is required normally, and they will actually arrange to get that medical certificate, and then a care plan and an individual assessment, and then with the kids they also want parental guardianship and that sort of thing. So yeah, that's the basic thing of them getting into the centre to have that referral done, and then that social worker, she'll now follow up with us, and then you know, see if they meet the admission criteria, which is really just, you know, do they have a drug problem or not.
But the journey to a healthy, sober life is not a quick and easy one. It is a lifelong commitment of dedication and hard work, a way of life that many Nyaope addicts are not willing to take.
So what you get in your body is really a bad impact on a person, and that makes the recovery, the withdrawal symptoms are so much more severe, and it's very difficult. In our situation, we help the people by giving medication to make it more easier, because we want that they must get as soon as possible clean, that we can start with the rehabilitation process.
Yeah, not too so for the guy.
I wish I can tell back. I wish, it's only wishes, but I think God is watching. Mama is going to answer soon or late. I just wish.
As this new phenomenon grows amongst Nyaope addicts, the fight against this war is far from over. But this phenomenon is something that has taken the community by storm. Suffering from an addiction? Need help? Contact Sanko on their WhatsApp line on 076 535 1701.